If we look at blood collection during this period of the pandemic, it is estimated that between 70 and 80%, there has been between a 70 and 80% drop in blood collection during this pandemic year times in many parts of the world. We in Kenya have recorded a drop from the 450 pints a day to about 250 pints a day. So the launch of this campaign is extremely important because we need to increase the number of pints that we collect in a day. And you all are very well aware that we have faced challenges as far as our national blood transfusion services is concerned. Challenges that as a ministry we are diligently addressing in order to improve service delivery in this sector. Recognizing the need for additional investments in this sector, the government has initiated a number of programs to be able to build up the capacity of the Kenya National Blood Transfusion Services. We have increased the number of human resources within this facility by posting an additional 22 members of staff to the Kenya National Blood Transfusion Services. We have also arranged for additional resourcing of this facility, and we will be pumping in about 1 billion Kenya shillings through a World Bank program in the coming months to upgrade and improve the level of services, the level of blood collection within all the satellite sites and sites that collect blood under the Kenya National Blood Transfusion Services throughout the country, to ensure that we have enough commodities that are required for blood collection, that is the blood bags, and everything else that is required for that supply chain, and also to ensure that we have the right equipment and reagents that are required in the lab to ensure that the blood we collect is properly handled, processed, and is safe for transfusion to patients. And we, including, as I should add to, including looking at the governance structure of this very important service sector with a view of improving that through legislation so that the National Blood Transfusion Services can become a semi-autonomous agency that will be able to function with some level of autonomy and hopefully effectiveness and efficiency. These are all plans that are in the works, and I'm sure that in the next coming months we should see some activities in that area, even though the COVID-19 pandemic situation, of course, as you will all agree, has slowed down a number of activities. So, ladies and gentlemen, as part of effort to appeal to our people to volunteer and donate blood, we have also collaborated with partners, leveraging on the importance and utility of ICT in service delivery. Ladies and gentlemen, I am delighted to inform you that today we have discharged 72 patients from various hospitals who have recovered from the disease. This brings to 1,164 the total number of those who have so far recovered from COVID-19. This is good news. I think every time we see good numbers of recoveries, it's good news for us because it shows the balance between those that we are confirming positive and those that we are discharging. Remember that this is an in and out process, so the more we discharge, the more we will be able to handle as if our numbers rise. But it is also a clear indication that COVID-19 disease is not a death sentence. You can get COVID-19, you can recover, and you can move on with your life. To overcome this disease, it is very clear that we have to follow and adhere to the advice that is issued by the Ministry of Health. As we have said repeatedly, to beat coronavirus or COVID-19 disease, we need to be able to contain it, and the containment measures of hand washing, social and physical distancing, wearing masks, avoiding large gatherings, staying at home when you can, and minimizing any situation where you will be interacting with others. Those are the key measures that need to be observed in order to break the cycle of spread of this virus. Now, when we come to testing, today we have tested 2,000, over the last 24 hours, 2,419 samples, bringing to a total the number of tests that we have so far conducted to 108,666. Of these 2,419 samples tested over the past 24 hours, 90 have returned positive for the virus. And this number now brings the total number of COVID-19 positive persons cumulatively to 3,305. All the positive cases are Kenyans. 62 of them are males and 28 are females. The youngest is 14 years old and the oldest is 80 years old. These 90 cases are distributed in the following counties. Nairobi recorded 36, Mombasa 34, Busia 12, Uasin Gishu 3, Kilifi, Garissa, Kisumu, Meru and Turkana 1 each. By sub-counties, the Nairobi cases are from the following areas: Kibra 12, Makadara and Mathare 5 cases each, Kamkunji 4, Langata 3, Westlands and Embakasi Central 2 each, Dagoretti North, Embakasi West and Embakasi South 1 each. In Mombasa, the 34 cases are from Mvita 14, Kisauni 8, Likoni, Jomvu, Changamwe 4 cases each. In Busia, all the 12 cases are of truck drivers at the Malaba border point. Garissa's 1 case is from Garissa Township. Kilifi's 1 case is from Kilifi North, and Kisumu's 1 case is from Kisumu Central. Meru had 1 case from Imenti Central, and Turkana 1 case from Turkana West. Unfortunately, we have also lost 4 people from the disease, which now brings the total number of people who have succumbed to this disease to date to 96. We send our heartfelt condolences to the families and friends of the departed. As I conclude, I want to extend my appreciation to all individuals, groups, and companies that have partnered with the Kenya National Blood Transfusion Services in this campaign. Once again, I want to appeal to all Kenyans to come out in large numbers and donate blood in order to save lives of others. Finally, I want to remind Kenyans that we must strictly observe the COVID-19 containment measures because they are the only known modes of behavior to successfully fight the virus.
Yes, before home-based care protocols were launched, there was a pilot already being undertaken involving about 299 patients on home-based isolation and about 15 mothers who are breastfeeding. I'm happy to report today, yes, about 208 of them have been released from home-based care back to the society. They are safe and they can interact with you. There's no need for stigmatization. They are as good as you are. So yes, it's a success story that home-based care protocols can indeed work. Thank you.
Volunteers who will be deployed to the homes, and what parameters will you put till they have a relative in hospital to give blood than just give willingly? And
what do you need? That's it.